This is Fat Daddy. He was surrendered a couple weeks ago to us. He is about 13, so he's an old guy. Has not missing, but completely worn down all of his front incisors and his canines. And a little bit of arthritis that we found. But he is getting neutered today and is going to get up to date on his vaccines, his flea tick, his dewormer, because he is going to be going to a nice little retirement home. If I can remember the long name, it's the Old Dog Senior Sanctuary. There's a friend in there, Old Dog Friend Senior Sanctuary.
Something like that.
Either way. They have agreed to take him, and we are super excited because he is a great dog. He's super friendly. He loves going for walks, gets really playful in the morning. So we're very happy that he will have somewhere to hang out and relax for the rest of his life.
Old Friend Senior Dog Sanctuary.
There we go. Old Friend Senior Dog Sanctuary is where he is going. He says, I like my close-up. Okay, ready? You're gonna eat this with you.
So what are you giving him?
So this is Pyrantel. Just kind of like a routine dewormer. Just in case he does have anything in there. It can be used kind of as a preventative. Some people give it regularly. Some just give it if they end up having worms. So his is more of a preventative right now.
Maybe while he's under, I'll ultrasound him and there might be a murmur. I'm not so great with dogs. Sorry, bud.
You can't hear if you're panting.
Alright, can I see your nosy nose? Boop. Good boy. Oh, yeah, good boy. He's like, why would you do that?
So that was his Bordetella vaccine, which helps prevent kennel cough. So that'll be a good one since he's going to somewhere with a lot of other dogs. Yeah. I do believe they keep all of their dogs up to date on vaccines though. So much less of a risk, but always good to prevent.
Yes. All right, sir.
Bless you. Okay.
You have like very little muscle mass back here, so I'm sorry. Let me go. That right there. I'm sorry. Good boy.
Good job.
All right.
Little nappy time, okay? Gosh. I'm gonna blind you a little bit here, okay? I know it's weird. I know. A little more in there. I know it's very weird and cold. Oh.
Trying to keep your surgical field
I know.
clean.
It was hard. Good in there?
Yeah.
So that's a better view of his teeth. So he's not actually missing them. They're just completely worn down. But then all of his molars are fine. Like all his...
He might have been chewing rocks.
Yeah. Because his molars look great. He doesn't even have that much tartar on him, so he was chewing something.
All right, and if you don't mind getting the 2/0 for me, and then the 0 so I can do the ties with it. There you go.
Do you just want the reeled
Sure.
one? Okay.
I'll try not to use so much since I know
That's all right.
it's all back order, right?
Yeah. But we can always order a different kind if we need.
Yeah. Okay. That should be enough. Go in there.
Fat Daddy here on the table getting neutered. He is an older guy. He's 13. So we do run higher risks with anesthesia for him. Some of the drugs that can be used for anesthesia They may not be processed by different organs as well in older dogs. Liver, kidneys, you can see more heart arrhythmias and things while they're on the table, issues with respiration. So we monitor them a lot closer just to make sure everything is going okay, and make sure that we're not getting them, you know, too deep into an anesthetic plane that's unnecessary, but we also don't want them to be too light where they're feeling any pain or at risk of just waking up on the table. So these guys, it's always a higher risk, but because he is going to the old dog sanctuary, they did ask that we, if possible, have him neutered up to date on his vaccines beforehand. So we are more than happy to tackle that. And so far he is doing great. We'll just keep keeping a close eye on him, and hopefully everything will go well.
So what are you checking?
I'm just seeing, because he wore these down so far, a couple of them have like little tiny open holes. So I was just kind of probing them to see how deep they are, to see if it might be causing him pain. This canine over here seems okay, but this one incisor in the front, it's kind of soft. So it's probably going to the pulp in that tooth, which can be painful, and potentially lead to infection.
Oh, I don't want to make a knot. There we go. Now, how come that skin came together perfectly, but the other skin, even though I did it 2 times, I was like, nope, not going to do it.
Is the stitching part kind of like satisfying?
It can be, but if they're ugly or don't go in like the way you want them to, then it's really frustrating, because it's something that should be pretty simple and look really nice, and it doesn't. Dang it. Back and through. Out it came. I'm closing the skin incision. So we do that with there are several different patterns of suture you can do. We like to do horizontal mattresses here because it's tension relieving. So if it swells, it's supposed to give a little bit better than some of the other patterns. So that way the skin isn't like super painful, stretched, itchy, that kind of thing as it heals. All right, so we just got done neutering Fat Daddy so he can go to his retirement home. He did great. So we just gotta wait for him to wake up. He might snooze for quite a while since he's an older gentleman, and he possibly has some metabolic changes with his liver and kidneys and stuff like that with his age, so he might take a longer time to process the drugs we gave him, but he did great.
When will he be going to his name?
Hopefully within about a week. They were just waiting for one of their intake runs to open, and she said it should hopefully be within the week. So then it would just be a matter of coordinating a good day for them and for us to get him out there. Because I believe they are located just on the other side of Nashville. So it's probably about an 1.5 to 2 hour drive. So.
Hey, look at my old man, wrinkly first. Oh. Cutest old man ever. Oh, well, taking it with us.
I know.
This morning, Silhouette is coming back. She was adopted previously. She was actually one of my first adoptions when I first came out here. So her owner is just saying she's a little too spicy for her. So she's gonna come back, and we're gonna put her into our training program, let our gentlers work with her a little bit more, and hopefully get her adopted out again into the right fitting home for her. So we'll be waiting this morning for Silhouette to arrive. Hopefully everything goes smoothly and we find her a home also. Come on, big girl. Our transporter just dropped Silhouette back off, so we are gonna just keep her in one of our more distant pastures just in case she was in contact with other horses and everything, just so we don't get our general pop horses contaminated. Once that's over, our vets are gonna check her out, make sure she is up to date on all vaccines and everything, and she gets a clean bill of health. Then she will go over to our gentlers in the training barn. They'll assess her, see what her quirks are and everything, and hopefully everything goes smoothly and she gets out of here and goes to her forever home.
The hail damaged the roof on the bunkhouse and made it leak more than it possibly leaked before. So I'm replacing the clear span with a couple solid pieces of metal, which will prevent all leaking in the future, we hope. Well, careful, bud. Gray decided not to hang out with me while I fix this, so that's okay. So when they sold us this, they promised it was a 35-year poly, and as you can see, it just breaks. So, worthless. Don't do it. It's not gonna last. It's only about 10 years old. So, definitely not a 35-year product. So someone previously caulked all over this, made it much harder to replace it, and they even spray foamed. Which that's that's not holding. I'm gonna have to go get that later. This board right here, it was rotting right there. And it's still gonna hold it, but it's a little soft. Oh, it's so windy. 49 screws and I'll be done. 50 screws. Got the roof replaced. I don't think it's gonna leak. I'm gonna go in and take a look and see what it looks like from the inside because it had nice skylights. Now it's solid. Well, it's a touch messy, but you can see it was leaking around up through there and also down through the walls, and that's just solid metal. So it should be just fine. Both of these will be fine. Now what's cool is I got to throw all the extra buckets, all the extra screws into the bucket. So when this is clean, they'll be able to do that. But this is a nice little bunkhouse. It holds 4 people. And it's got a little fridge and a little cook stove and air conditioning and heater, and it's a nice bunkhouse, and we want to keep it solid. So fix the leaks when they happen, fix the broken things when it hails.
Hi, this is Dr. Lydia. I'm the head shelter vet here at Plus Humane Society, and we just wanted to let you guys know that if you have questions for our team, often people put questions in our video comments, and I don't ever look at those. I think some people on our team do. If you have specific questions for our team, feel free to send us an email. The best email to do that is info@horseplus.org, info@horseplus.org. And we will do our best to answer your questions in a timely manner. I think probably the easiest way to do that is when we compile them. Sometimes I have time to email people back, but usually we just on the cuff have our video team ask us questions and we kind of answer as we go along. So shoot us an email if you have questions. It's a great question. I wish Dr. Gina was in here. She's our cardiology guru. Yes, hydration status, circulatory volume, electrolyte imbalances can all affect cardiac rate and rhythm. One of the lovely things about working at Horse Plus is that we have diagnostic equipment. So any horse with a grade 3 out of 6 or higher heart murmur gets a cardiac workup, including a cardiac ultrasound. So the ultrasound lets us visualize blood flow and further characterize it in stage disease and measure the width of the heart muscle. And you guys don't always see that. In some cases on our buyout exams, and this happened this week, we have horses with severe comorbidities. So if I have a horse that has a fractured leg and a heart murmur, I am likely not going to do a full workup on the heart issue because we're having to make a last act of kindness decision on that animal based on some other reason. But any animal with a mild heart murmur, a lot of them are very benign. And so we're depending on those diagnostics to further characterize and help us guide course of treatment. And sometimes we have horses come in with severe dehydration that we note a cardiac abnormality, and then on recheck, that animal is normal again. So great question. The answer is yes. And the action steps are all based on those further diagnostics. The other thing we don't talk about a whole lot, and I don't want to get too in depth, is that horses have 4 major valves in their heart. We hear 3 of them on the left, pulmonic, aortic, mitral, and then tricuspid we hear on the right. So we're able to do a lot more with a physical exam, and we're noting on our form where we're hearing the point of maximum intensity. Left versus right matters, and where on the left we're hearing a murmur matters. So there's a lot more than just that number that you guys are hearing on video most of the time. The answer to that question, suture material choice totally depends on the species, the size of the animal, the location on the body, and the type of surgery. The suture material that I like and use most often is called PDS, polydimethyl sulf something. I'm not really sure. That's kind of like the Kleenex to tissue, but it's an absorbable suture that takes about 60 days to absorb, but it can take up to 6 months. So I use that same suture, for example, if I'm spaying a dog, to ligate off the internal structures, because that's going to then dissolve, to close the body wall, which is the holding layer, to do the subcuticular, and to do the skin. Or like for a neuter, I would use, again, that same suture inside the dog as well as on the skin. You can use non-absorbable suture in a lot of places, but I find that tissue reactivity over time is greater if you have a substance that's going to persist forever in the body. Some vets use like a hemoclip, that's a little piece of metal that stays in the abdomen for forever. So a lot of it is individual choice. There are suture types like chromic catgut that are really outdated. So there are, as medicine goes on and as we learn more, standards of care change. So as long as we're meeting a standard of care, vets are at liberty to kind of choose between different things. So sometimes they use silk on eyes. Like there's different types of suture material you might choose for different reasons. Sometimes you want tissue to scar, and sometimes you don't want tissue to scar. Sometimes those scars help, like if a cow has a displaced abomasum, you want that tissue to kind of scar down to the body wall because it's going to hold that part of the GI tract where you want it to be, and that's the point of your surgery. But for the most part here, we just use PDS. We use different sizes depending on the size of the animal and what we're doing. So I hope that answered your question. Lots of caveats to that.
Today is buyout, and you're going to see something you've never seen before because we have a host of zoonotic diseases that we are documenting in horses to the effect that our board of directors decided we need to wear PPE to protect ourselves and our staff. So once they're tested and we know, but we won't get the results sometimes for several days. So we're doing the intake. There's over 20 horses, some in horrific condition, and we're going to be going through each one and helping each one we can. But buyout days are really, really hard, and I think seeing our team in the PPE is just really sinking in that, you know, there's the zoonotic factor, and we've had 3 cases of diphtheria. Diphtheria is not supposed to be in the United States with horses and stuff, so it's crazy. There's another horse coming in right now, so I'm going to go over and help with that horse.
So I am doing Coggins photos right now, so that will go on their blood tests, and then just keeping Facebook updated today. But they're keeping me busy for sure. We got a lot of horses to do. So far, because we come in with our more serious cases first and we make them priority, it's been really hard seeing the conditions that they are coming in and having, you know, good hopes for them, but also preparing for the worst.
We have this horse right now with Sydney. Dr. Lydia is going to go get him some pain meds, and then they're going to assess this horse next.
my friend.
So I am filming for the Almost Live. These are some of our most popular videos because this is what happens when we're intaking the horses from the buyout rescue mission. And I don't like bragging about it, but it is a lot of work to film, edit, and release them the same day. But I think everybody loves it, and the views reflect that. So if you haven't seen it, go find it. April Buy-Out Almost Live.
Come on, baby.
This poor guy has lost a lot of hair. It could just be shedding, but could also be lice. See how it's really patchy?
I'm just bringing myself and my stethoscope, yes?
So this horse behind us is a 3.5-year-old thoroughbred gelding, but his microchip right now, there's some debate, it's registered to a mare, so we're double checking that. He's a little kicky at people, so we're going to keep him on our caution list, but he just got a rabies. He probably has brain rot of a bacterial infection type, so he really needs a medicated bath quite frequently. So he's getting his rabies, a dewormer, and then we're probably going to put him out in pasture to decompress and recheck him to see if he's still trying to kick people.
Okay, they're going to take him out. Very tall boy. Okay, he's just going back to the pen.
Quick second, and also point something out that we see here at Horse Plus very frequently, especially on buyout days. So see these little wadded up balls of food, and this is a very common photo I get from clients. Like, I keep finding this in my pasture, what's going on? So the technical term for this behavior is called quitting, Q-U-I-D-D-I-N-G, quitting. It sounds like Quidditch if you're a Harry Potter fan. But that indicates that somewhere in the mouth, the occlusal surfaces aren't functionally reducing particle size like they're supposed to. And so that definitely is an indication that your veterinarian should come out and sedate your horse and put a speculum on and do a full oral exam. And 9 times out of 10, there's a sharp point somewhere, or the horse is avoiding some kind of pain or imbalance in their mouth, and that's an indication for correction. Unfortunately, we also see it in the very, very old ones, and it can also be an indication that as they age, the rate of growth of their teeth slows down, and they're just not keeping up anymore. At some point, those teeth get worn down to the gums, and then you see this happen because they just kind of move the food around in their mouth indefinitely, and then eventually have to either try to swallow it. And often we see chokes in those cases because they're trying to swallow a big wad of improperly chewed food, or they just drop it out of their mouth.
You can say I have a horse standing in thick grass or a bunch of hay, and it can literally be starving. This horse is really, really skinny. So you can't be like, oh, it's got plenty of food, it's fine. Not with horses.
Yes, because they're not actually utilizing their food stuff, their hindgut microbes are.
Just nasal swab.
Just looks like pretty normal serous nasal discharge.
Yeah.
He was with the other one. Baseline heart rate is only 44, so.
Dr. Lydia is examining this little gelding. Not sure how old he is yet, but it does look like on this front right leg that he has an old carpal fracture. So we're gonna get some radiographs of that. But basically today you have the tube. I'm keeping Dr. Lydia organized. And that's basically my role today, is just kind of trying to keep things flowing well and making sure everything's getting taken down for notes, making sure we're kind of following all our new protocols that the board put in place, and see how it works today with the new protocols and everything.
Now we're going to bring them out, and they're going to do x-rays. So Haley, Dr. Gina, and Cody are helping with the x-rays.
Oh my
Ugh.
goodness gracious.
Oh, that's not great.
Did you see any, Nicole? What is it?
It doesn't look great. I don't know. Would you eat? It's an old fracture, right?
It's a-
That's just.
Yeah, carpal fracture with severe osteophyte formation. But there's
Yeah.
Multiple fractures.
It's very, very bad.
Multiple fractures.
Yeah, so all that's abnormal. This is abnormal.
All the way in the joint.
That whole area should not be there. So picture every time that horse moves that leg.
This is B2581. He's a 27-year-old quarter horse gelding dun. He has a pretty significant swelling of his right carpus, and when we took radiographs, it is a very old multiple fracture healing kind of wound. It's old and stagnant, but it's involving across the joint and his metacarpus, the top of his cannon bone. When we took dental radiographs and wither radiographs, he also has some chips in his withers, and he has some pretty poor dentition that would need a lot of help. So given that he's already such an older gentleman, that's more than likely has been very chronically painful. He's already underweight. We just don't want to have to put his body through a lot more. So the last act of kindness has been recommended for him.
We're going to be taking a break for lunch. We're so incredibly grateful to the folks who donate towards our pizza fund for our staff. It's very busy and everything, and getting pizza on Buyout, it just makes our days a little bit easier up here, despite having a really hard day. So this little pony is just the most adorable little guy. He is blind, so he's apprehensive and stuff, but very well adjusted. I think Dr. Lydia so far thinks that he was maybe born blind, but he's getting his microchip and shots and stuff, so we're just kind of wrapping up before we bring a bunch more horses in here. But we're moving right along. The team is working extremely well. We are getting a lot of questions about the PPE that we're wearing, and it is to protect us from zoonotic diseases. And we'll go into that in further detail later. But yeah, everything's going along really, really good. So we're going to eat lunch, and then we'll be back at it.
If you like what you're watching, please like and subscribe to our channel. And please share it with others.
Oh, poor baby. Looks like he got really chewed up.
He did, and after I called him, I thought, yeah, should I take him out of there? And I said, no, I'm not going to take him nowhere. I'm going to take him to Horse Plus.
Hi, sweetie. His neck is tore up.
He is tore up, and I've seen a lot of cats, but nothing like this one. When I was going to go by now.
So how long have you been with the Centerville Animal?
About 2.5 years.
Yeah, and what were you doing before that?
I was working at the County Highway Department, running the grader and co-op.
How did you get into animal control?
The boss called me and he said, would you like a job? And the job come open, so I took it.
There you go.
And I've been there ever since.
How you been enjoying it?
It's good. It's got its ups and its downs, you know, because it's got good days and then got bad days, so.
Absolutely.
Yeah.
You do a lot more good than bad, though?
Yeah, most of the time. I adopted one last week that was a real good story. He seems like a good cat.
Well, I can't get it now, Wilbur.
Okay.
Come over here.
Come here, babe. I think he'll be easy to handle.
Oh, now he's laying down.
Well, I've been on the board for Horse Plus for about, I don't know, pretty good while.
Yeah.
Yeah, I've been on the board at Horse Plus, plus I'm a Tennessee State Constable here too, in Centerville. Look, he wants to lay down and play.
He's trying to do flippies. Archie's.
Yeah, I think he's a good cat. I mean, I really do. That's why I figured maybe if we could fix him up and get him home. I know. I know, baby. I know.
He's so hard when you're sweet.
Man, I don't
Oh,
see.
here comes Dr. Lydia.
I got a cute baby with no home.
Hey, Wilbur.
Hey, how you doing, buddy?
Nice to see
I
ya.
got a wounded cat pretty bad. Both sides of his neck is wide open. One of them looks like an old wound. Like I said, I can normally handle him, but I didn't want to nap him and hurt him.
Yeah. I don't think we're gonna need to scruff him. He looks really sweet. What I'd like to do is put him under anesthesia. I think he's just got a big abscess in his cheek, and if I can just flush it out, give him some antibiotics.
And kind of treat his wounds, maybe?
Yeah, it would be super helpful. if we could just get him over here in our treatment room.
Yeah.
And then I
can put over there.
I'm comfortable getting him out myself without scruffing him.
You think
So yeah, let's just go straight in our hospital into the treatment room.
That's what I was telling her. I normally scruff them, but I didn't want to.
I'm glad you didn't. Are you making biscuits? What a good boy. And we can neuter him at the same time and do the tests and stuff.
Then I guess your name will be Sylvester.
Okay. Yep, Emily, we're gonna go right in there. Come on, handsome sir.
Need some help?
Oh, there's a good boy. We can get you taken care of.
I think you'll be a great cat for somebody.
Listen, you know, most people that come here looking for a cat, they want a good barn cat. Okay, so we're going to gently pull him out, poke him, and then we'll just put him
You want me to open this side?
in an induction
Come out,
cage.
he'll come
Sure.
out.
Yeah.
I know.
Oh, there's a good boy.
Mm-hmm.
Okay.
You ready?
Yeah.
Okay, come on, baby. Come on.
Other side.
Oh, there's a good boy. Come on. Oh, there's a good boy. Oh, good boy. Good job. Okay. Good boy. Okay, good job. Okay, we're just gonna put blanket around him. Good job. And I don't think you'll need to scruff him. Good. Perfect.
I think he wants to.
Okay. Oh, good job. Just kitty burrito, huh? Little poke. All done. All
It's
done.
okay. It's okay.
All done. Okay, we're gonna go right here. Good boy. Good boy. Awesome. Well, thank you. I'm gonna open this back up, and I'm just gonna go grab him an exam sheet. We are so happy that you brought him to us. Thank you. This is just an abscess.
Is that what it is?
Yeah.
Because I was afraid to nap him, you know.
Yeah, he's a fighter. Emily, I would love. He's missing.
Sure.
Oh, this is an old kitty. Yeah, look at this boy. He's been fighting. He's
Yes,
been fighting
he has.
for a living for a long time.
Yes, he had. He must be a pretty good scrapper.
Yeah.
Because there was 3 other young, bigger cats in there.
Yep. Yeah. So he's got fractured incisor, missing incisor. So this gentleman has had an illustrious fighting career, I think. But so far, I don't palpate any fractures or anything. I think he's just, you know, when you fight and then you reopen the same thing and then you reopen the same thing. I think that's what we got going on. Yeah, this is old. This is old. Okay, we are gonna have to pop him in the surgery room for this, but then we can keep going. What's kind of a bummer to think about is that if somebody had just neutered this cat, he probably wouldn't have spent his whole life fighting and broken his teeth and had a bunch of abscesses. And probably had a better quality of life, not fighting in the streets. Have you ever seen the Bodies exhibit?
No, I've always wanted to go.
Me
and
too.
See.
So it's just crazy art exhibit, and it is preserved bodies at varying degrees of dissection. It is like real human bodies with like just the muscles and like just the nerves, and it's a bit creepy because they're human beings. Okay, so I don't think I can close these. Emily, what I would love, if you want to put on a pair of, they don't have to be sterile, go grab some non-sterile gloves and bring the chlorhexidine, the pink and the alcohol scrub that we do to prep in here, and we're just gonna scrub these wounds up really, really well. Okay. So this is a great example of how really fresh wounds we can close. Like this was a L-shaped tear, but this whole section of skin has just scarred in a little nub, and so this is gonna have to heal by second intention. There's no way I can sew this closed at this point. Actually, that cleaned up super nicely. I don't know that that looks great on the pink ones. Ooh, your ears are disgusting. Ooh, buddy. You're gonna feel better when you wake up.
I'm gonna check his test.
Thank Thank you.
He's clean.
Sweet. Fabulous. So once we get all this gross biofilm off of here, this is gonna heal a lot more quickly.
How often would you say you have cases like this come so sporadically?
Oh, well, at the vet clinic where I do relief work, it's very, very normal to have like, here's this outdoor male cat that appears to have been in a lot of fights. But here at Horse Plus, we don't see, I mean, Dr. Gina and I are both primarily large animal vets. Although in vet school, we're trained to treat all species, as evidenced by the fact that I graduated and as a baby vet went and worked on elephants. We don't discriminate on what we're allowed to do after that, but what's tough about these for me is that they really should be considered preventable, in that if this cat had been neutered at a young age, he wouldn't have been out there fighting, and so he wouldn't have. Obviously, I'm speculating, right? Like, I can't prove this cat's history, but all of his broken teeth and wounds are consistent with cat fight wounds. So what I do want for this guy that I can't do at this very moment is some radiographs. He feels a little stiff through his spine, and I want to make sure he doesn't have any bullets or really bad arthritis or anything like that, because we don't actually know how old he is. But overall, based on what I'm seeing, I think he should do great, and he's got a great personality, so we might be able to take those radiographs without sedation. We get a lot of random medical things donated, and we always try to use them. Our local food bank got this stethoscope, and I always keep it because, especially young kids that come, everybody loves a stethoscope. But for horses, you need a really high quality one because their chest is so wide. But I'm thankful that this was here, because cats have little narrow chests, and I was able to listen to his heart and lungs just fine with this one. So I'm glad we had it as a backup. Mine is up at the barn where I was treating horses before this cat came in. Okay. This handsome boy was a very good boy. He tested negative for FIV and FELV. That's the feline leukemia virus and the feline immunodeficiency virus. So those are not great. So he tested negative for both of those. Emily and I were able to clean his neck up. The wounds, I think, are from old abscesses from fighting, and they're old. So I really couldn't close them. If it was just one side, I might have been able to, but I would have had to kind of elevate the skin and pull it over, and he's got them on both sides. So we would have had this little strip of skin right here that would have been too far stretched. So those are gonna have to heal by second intention, but we were able to neuter him, do a full exam. I'm about to give him some sub-Q fluids. We gave him some vaccines. He does need a dental cleaning. We don't have a dental cleaning machine here at Horse Plus, so that's not something we can do for him, but we do have some great small animal partners with other resources at other vet clinics. So for today, he should be stable, and we'll give him some pain medication when he wakes up and make sure that he does well, but I'm optimistic that he'll make a recovery and make somebody a great barn cat.
Putting out updated kennel cards, so y'all follow me.
Gunpowder.
Can you tell me what's on here?
Okay, so on these kennel cards, it shows their animal ID, the day we got them, if they're male or female, their age, their breed, and their color. Also, it shows their microchip number. You can barely see it. For some reason, it cuts it off, but it gives you an idea, which is pretty important. Like if a horse gets out and say nobody's here and they don't really know where they go, they can always look at their kennel card and it's always there. Also, if somebody's walking by and say like Chinoa had like a hurt leg and they were like, oh, you know, that little horse, they would know that it was Chinoa if it's in their things. So we do need some updated ones for sure. Okay, so right here I'm putting Gunpowder and Monty in there. And I'm hoping that Bruno and Blue Jeans, their kennel cards are in that other one. Because we did just move so Keith could spray the fields. But those are those guys. You can come up. So sorry I don't have a treat. Gunpowder is available for adoption too, and Monty. Oh, he's getting close. Lynn usually has treats for him, and they'll walk up to Lynn. She's got the treats. We have a roadblock. What is it? What's the matter? In this field, we have Halea. Is that how you say it?
Halea?
Halea.
I'm probably butchering it too, but...
Nada. There you go. I know that's not how you say that, but Haley said just call it that. Ka. And that's all for this field. In this field, we have Katori, but she's actually, we just passed her. Kiona, Ayani, and then we have Nana, but for some reason I forgot her, and she's actually the one I know best, but I forgot her for some reason, but she's way over there, so we'll get her card fixed. We're in quarantine now, and we're in the holding pen. We have Jazzy, Daffodil, and Skeeter. It's so sad that he had a halter on that long, but it made an indentation. This is gonna be Nash. He's trying to eat the camera. There you go, buddy. You got your picture all fancy. So here we have Blackberry and Wallen. And P4. Hi, buddy. What you doing? I don't have a treat. Oh, now he's mad.
And is that everybody?
That should be everybody. I have to get Nokomas and Sego Lilies up with some hay string or something. And then they should be good because somebody ate their plastic holder, but that's okay. I always tell people not to get attached. It's really hard not to do because they come in and you're like, yes! But you just never know which way the wind is going to blow with these animals. Sometimes they look stable, and sometimes they come in and they look terrible, and then after 30 days they look great. So it's just kind of like we have to see how the 30 days go. We're running blood work. Dr. Lydia did all the cord records to send out the nasal swabs.
With Mari's help.
Yeah.
Thank you, Mari.
They're working on Coggins paperwork. I'm doing the blood work. So we have kind of a divide and conquer method that's working really well for us this time. But it was a lot, but I think it went really well today.
Yeah, buyout days, I kind of feel like I get hit by a little bit hit by a truck at this point in the day. We're kind of like, it's a lot of emotional and physical. The 3 horses that were in the best shape were the 3-year-old thoroughbred, the little mule, who was a really good boy after a while, and then the 18-year-old Mustang, who has vision concerns, but then even some of the ones that look great. Dr. Gina just ran blood work on the thoroughbred, and he's severely dehydrated, really high hemoconcentration and anemia. And so it's great to have those diagnostics. Sometimes it's a little frustrating because you're like, this horse looks awesome. And you're on blood work and you're like, this horse does not look awesome.
Yeah. It was just a snapshot. So we can take serial snapshots and see if there's a trend.
Exactly. And we don't ever want to give up on anything, you know, like if there's any chance, especially if we can keep them comfortable, we want to try. That young stallion that we got today is super lovely, and I keep being like, what are we missing with him? The ventral edema. So we haven't run his blood work yet. We got a lot of yearlings, which, man, is so tough because they're babies, you know? They still really are babies. They're immature, their immune systems are immature, and they're all sick already. Really bad nasal discharge, lung sounds, enlarged lymph nodes. this is what we continue to see. And then they just got shoved in a trailer with a bunch of older horses that were also sick, and had a very stressful ride. So trying to figure out quarantine places for those animals to optimize their peace and chances of resting, but also enable us to provide them with care and rechecks when they need it, is always kind of this. We have this adorable little mini that's totally blind. So then it's like, is it worth turning him out with big horses where he'll get sunshine and grass, but he could get stuck somewhere? Or do we put him in a stall? You know, trying to work through all those things. It wasn't the worst buyout day, but we had a lot of hard calls. A lot of old fractures that should have been addressed years ago. And those are the ones that just really keep you up at night, because it's really rewarding to alleviate pain. But then you're like, I know there's other horses out there in the same condition. Makes me want to be like, everyone, go walk around your neighborhood. And if you see a horse whose leg is obviously broken, please call someone and intervene. But yeah, we can only help the ones that end up here. So
yeah,
that has to be enough for now.
I'm heading up to flip over a shelter, hopefully back onto its feet, that rolled over when it was super windy here the other day. And I'm taking my truck because if I used the tractor and it flipped onto its feet and then flipped again and then flipped again, it could hit me on the tractor. With this, if it flips and flips again, I'm going to step on the gas. I'm going to be out of there. So it's a process, and I'm hoping that it will remain undamaged as much as it is now when I actually go to do it. And there's horses everywhere, so this is going to be a bit of a situation, but I want to see what we can do, and it's right over there, so just have to get through this fence and move the next one and move the next one and see what happens. So it's going to be a little bit challenging working in this area because there's a couple horses here, there's a couple horses there, and I think 1 or 2 horses in that one. So I'm going to have to make sure the horses don't start commingling and causing all kinds of chaos. So we'll see what happens. So this is the situation. And I'm seeing there's a little bending right here. Some nails are popped, a lot of nails are popped out. The big board is broken right there. And this whole thing has to go back up and over without, hopefully without breaking more. Standing here, it's getting a little discouraging because this thing is so big and so massive, but we can't like lift it from here because we don't have anything that could lift it high enough without damaging the roof. So I'm going to tie a strap across there, run it across the back and down, and maybe the whole thing will rotate. Maybe. So if I can get that thing to stand up, it would, I believe it would hit these where they're at, but not by much. Oh boy. All right, guys. How y'all doing? This is called a strap. Yeah, these horses are all wondering what in the world's going on here. I might have to get a horse handler up here to keep the horses out of the way. But situations like this, for sure, the more people, the more dangerous you can have it. So. All right, so I told everybody, I said I need a 1+ horse person at Gray Shelter to keep horses from getting squashed if I manage to get it to roll over. So we'll see who shows up. But in the meantime, gotta stay busy, so. So some people would just knot these, and then you kind of ruined your straps. If you run them through this, I think that it will hold just as well. And I won't be ruining anything if I can get them both to come through here. Oh yeah. Let me try. I'm gonna need more muscle. I tried. Basically, we're gonna have to keep these horses from all coagulating with the other horses. So Justin, you're gonna have to keep horses from coming out here, out there, or going in there. See, if you get excited, they get excited. Except for Gray. Gray never gets excited. All right, cool. So what do you guys think? Is this gonna do it? Or isn't it? Thumbs up, thumbs down, comment. I think there's a pretty good chance it might do it. There's a really good chance it could possibly do it. The key's here to make sure nothing bad happens to us. If you don't mind lifting on the other side, Keith, that'll be the nudge it needs. Yep. So what do you think happened, Keith? A malfunction occurred, eh?
You got too close to right here.
Oh, should we just tie the straps? Oh. Oh, it actually broke the strap.
I was telling you.
Yeah.
Huh. Well.
This will never come apart again. I hope you know that.
I'm aware. Never ever in its life will that not come undone.
Why don't you use it next time?
Now, let's rephrase that. This knot right here, once we put tension on it, will never come undone unless it breaks.
Unless it breaks, which it's going to.
Nah, we got it. I think we'd have to lift it a little bit with the tractor to drag. I'll try. When it broke, I was a little worried that it smashed my grill because it snapped back really hard, but it looks like it's fine, so. There we are, y'all. This is back exactly where it belongs in a like new condition. We will ignore all these tails that were broken when it flipped. Well, that's how it's done at Horse Plus sometimes, and super glad we got it done.
Hey y'all, just want to take a quick minute to let y'all know that if you like what you see and you want to see exclusive daily videos of like what goes on here at Horse Plus, consider becoming a member for only $9.99 a month. That's less than a meal at Taco Bell, so that sounds like a deal to me.